So in this video, I'm going to be sharing a lab test that I got called my CMP. If you're someone that has gotten this lab test or, maybe getting it, I'm sitting down with Dr. Saucier and she's going to help break it down for us. Welcome, Dr. Saucier.
Awesome. Thank you so much. And thank you for sharing today.
For sure. Now, before we dive fully into it, full transparency, I am willingly showing this information. Dr. Saucier, I understand, is not giving me medical advice, but this is really for educational purposes only. So Dr. Saucier, tell me the CMP panel, what is it and when would you recommend this to a patient?
Yeah, so a CMP is a comprehensive metabolic panel. It is a fantastic panel that we actually order often. The reason why is because it shows us a lot of different organ systems all at the same time. So a CMP allows us to look at your electrolytes. We're able to look at your kidney function, in big picture form. We're able to look at your liver function in big picture form, and we're able to look at your glucose. And so it is a fantastic test. Most medications that you're on, we will have to trend a CMP. And the reason why we trend a CMP or a BMP, which is a basic metabolic panel, it just has a little bit less, it doesn't have the liver function part, would be if we are giving you a medication that is either metabolized through the kidneys or through the liver. And so we would want to make sure that our medications are not causing any unwanted changes or damage to your organs. The other thing that we would often order is if we're looking for diabetes. One of the early things we can test is something called your fasting glucose, which is how high your sugar is when you haven't eaten. And so that's something that is a good sign if we're looking for metabolic syndrome, diabetes. And so that's a really good test. But again, we also can see if you're dehydrated on a BMP or a CMP. And so that's another reason why we would do this test. So CMP and BMPs are the cornerstone of a lot of testing that we do.
Okay. Yeah, it sounds like a good test to have. And I recently had it here. So I want to show my results here. And then I think what will be helpful is if we just kind of go step by step through them. Yeah. And then you can explain it to them. That's cool with you.
That's great. So let's start right at the top there, Spencer. So
sure.
We've got a glucose. Now, it's always important when we're looking at your glucose to see if you were fasting or not. So Spencer, were you fasting when you got your blood work done?
I do not think I was, no.
Okay. So if you're not fasting, then it's reasonable that your glucose is higher than normal, okay? Because anytime we eat, we actually are eating, whether it be an apple, whether it be a sandwich, you are getting glucose into your system, okay? We need glucose. And so what happens is when you're fasting, that allows us to see if you have what we call insulin resistance, prediabetes, or diabetes. And that's really important. So when you go for your blood work the phlebotomist should ask you, are you fasting on this blood work? Because again, a slightly elevated glucose like you have here at 115, all right, normal is less than 100, but more than 70. Well, that is typical if you weren't fasting, right? Your body is using the glucose that it saw recently. Now, if you are fasting and you have a fasting glucose over 100, that's a sign of potential insulin resistance or prediabetes. And if you have two fasting glucoses more than 125, 26, that's actually a sign of diabetes. And so we would follow that up with another test called the hemoglobin A1C. Now, remember, when you're getting a glucose in a BMP or a CMP, it's one point in time. So it's really just that specific moment in time, and it will change minute to minute, hour to hour, day by day. So it is not a hard endpoint, but it does change minute to minute.
I will say, and I'm not sure if this is the specific result, but I was on a corticosteroid. Can that have any effect on the glucose?
Yeah. So that is a fantastic point, and it's really important that you kind of let your doctor know that. So corticosteroids increase your sugar levels, they increase your glucose. And so typically, if you're on a steroid, we may see increased glucose levels without you actually being insulin resistant. You're not diabetic, you're not insulin resistant. It is a response to the corticosteroid.
This is a great example of we can search all this stuff online, but without having the proper context, there's so many different factors that it could go into play. And that's the importance of seeing a doctor. What about on the low side of the glucose?
Yeah. So some people have things like hypoglycemia. So if their glucose is too low, sometimes if their blood sugars drop, it can be a sign that they need to eat more throughout the day. Sometimes people with hypoglycemia need to eat smaller meals more regularly. Sometimes it also can be a sign of a different type of tumor called an insulinoma, which basically is something that secretes insulin, which drops your glucose. And so if we are seeing someone who has, their glucose is constantly on the low side, we're going to talk about diet. We're going to talk about kind of how they're feeling. What are they doing day to day? If they're on medications like SGLT2 medications or GLP-1 medications or metformin, right? If they're on glucose lowering medications, we might be overdoing it and we might need to back off, right? Or adjust if someone's having a lot of low blood glucose levels.
Okay, got it. All righty, makes sense. Okay, let's move to the next one here.
Yeah.
The BUN.
We're going to use the BUN and the creatinine together, all right?
Okay.
So the BUN basically looks at your creatinine, basically it looks at your renal function, okay? And so what we're looking at is our renal function. We're also looking typically if your BUN is high, it can actually be a sign that you're dehydrated, okay? That's one of the things that we typically will see in a BUN, but we always also want to look at your BUN to creatinine ratio. Again, this is based in the kidney function, and that's what we're looking at.
Okay, that's what I wanted to say. So just to clarify, the renal function, we're talking strictly the kidneys.
Strictly the kidneys, yes, exactly.
Okay, got it. And so these two are indicators of how the kidney is functioning?
Correct, how the kidneys are functioning and how much blood the kidneys are seeing. So that's why I mentioned if the BUN is elevated, it could be a sign that you might be dehydrated. Your kidneys are not seeing as much blood as it should.
I'm drinking water as you tell me this. Okay.
Good. See, you're staying hydrated.
Okay, awesome. All right. What do you think? Should we move to the next one?
Yeah, let's move to calcium. All right. So now we're getting into the electrolytes. So as I mentioned before, CMP and BMP are incredible. So you've got your calcium here, right? That's the level of calcium in your body. Now, calcium is really important because it helps us regulate different ion channels and helps us, all of our membranes function, including our heart membranes, okay? And that includes your calcium, your sodium, your potassium, all of these. And so essentially, your calcium, if your calcium's too high, one of the things we worry about if it's too high and it stays high, we want to look for things such as like a multiple myeloma could be a cause of the calcium being really high. Calcium being low, you could be either deficient or again, something else could be going on. And so keeping that calcium in a normal range is going to be really helpful for us, for our membranes and for everything to function. Same goes with sodium. So sodium is one of the most important markers from a heart failure standpoint, interestingly. Okay. So your sodium level is actually telling us how our body manages our free water. It sounds a little crazy. It sounds a little counterintuitive, but if your kidneys are working properly and your body is able to manage the water that it sees, then your sodium should be normal. And so you can have low sodium or high sodium, and it can be caused because you have too little volume, too much volume, or you can actually have normal volume in your body, but still have a low sodium because of a different process, such as SIADH or diabetes insipidus. These are certain things that can cause low sodium levels, but with normal volume status, meaning you're not too much fluid on your body and you're not dehydrated. And so your sodium tells us a lot. If you have low sodium and you have a history of heart failure, unfortunately, is prognostically a bad indicator of kind of your overall, how you're going to do your prognosis overall, because it tells us that your body's really struggling to manage your free water. And so that's kind of like high level why the sodium is so important.
Okay. So how I want to be able to comprehend this. So my understanding of the basics of water dynamics is pretty much you have your barrier one side and then the other side, and then they have different levels of salt. And
Yes.
if one side has more salt in it, then what's going to happen is that water is going to move to that side to equalize it. Is
Correct.
that right?
Yep. That's
Okay.
exactly right.
And so if I have too much salt on that side, what is that telling me?
So it depends on the why, right? It depends on the mechanism, and it depends on if you have too little fluid, right, which would be hypovolemic hyponatremia, or if you have too much fluid, which would be hypervolemic hyponatremia. But again, essentially, right, your sodium level, it all comes down to how your body's able to manage the water to keep you in homeostasis, so to keep things even. And I think that's the simplest way to think about it.
I love it. Okay, great. Cool. Let's move to potassium.
All right, potassium. So this is something every cardiologist loves and every nephrologist probably doesn't. All right. So the reason why I say that, potassium actually, if your potassium's too low or your potassium's too high, it can actually be very dangerous to your heart rhythm. All right. So when you have abnormal potassium, it can lead to cardiac arrhythmias like ventricular tachycardia and ventricular fibrillation. And so your potassium being normal is so incredibly important from a cardiologist standpoint. And we do give medications that try to keep your potassium normal. And we also give medications that can lower your potassium to help keep you in that normal range. But again, if we see someone who, if you say your potassium was 7, I'm going to use an example. If you get that lab back, someone's going to call you and say, please go to the emergency department because that is a critical potassium. Really, anything over 5.5 needs to be addressed. Okay. And anything, under 3 really needs to be addressed with either repletion and then again, we're depending on if we're too low or too high. But a lot of times, if your potassium's completely wrong or not great, we're going to bring you to the emergency department so we can make sure you don't have a fatal heart rhythm problem.
Oh, wow. That's really interesting.
Yeah.
And can I eat bananas to help me with this, or does that really not play a role?
It does. Yeah. So a lot of times if your potassium's just mildly decreased, so say you were at that 3.5 mark, right? Or you were at 3.4, I would say have a banana, right? Have some food that contain potassium. Now, potassium is also really important from a kidney side of things. And so oftentimes if you have kidney problems or if you're on dialysis or you have renal disease, you're supposed to avoid foods with potassium. And so it's really important that based on your medical history, you know what your potassium level should be because it's not going to be, it's the normal potassium range is the same for everyone, but how much potassium you can eat per day might change if you have significant kidney disease. We want to do a low potassium diet for people with renal disease.
Okay, makes sense. Alrighty, let's move to chloride.
All right. So chloride goes hand in hand with your sodium. Okay. So we think of salt, we think of sodium and chloride, right? And so it is another electrolyte that we're going to look at to just, again, see kind of how your volume status in your body is. Are you dehydrated? Are you not dehydrated? And so how much fluid you have on board.
Got it. Okay. And then looking at the rest of these ones here, which ones do you think are important to cover?
Yeah. So I think the important ones to cover, things that really matter to us in the hospital are your anion gap. Okay. So if you have a high anion gap, basically that shows us that there is a discrepancy, okay, in terms of your ions in your body. And so it can be really dangerous if you have a high anion gap. So that would be something that we would want to watch out for.
Ions in your body, like what's an ion?
I'm trying to think of the best way to kind of describe this. So we look
Or why is it important?
Well, it's important because if you have an anion gap acidosis, if you have high anion gap, you then a lot of times will create an acidosis. And our body is not meant to be acidic. It's meant to be, we have a pH in our body, it's supposed to be 7.4. So if it's too low and you're acidotic, you could die from having low, being too acidotic. And so if you have an anion gap acidosis, whether it be from diabetic ketoacidosis, whether it be from infection, so we would see that lactic acidosis if the organs are failing. So an anion gap is high anion gap is very dangerous and what we watch out for. Low anion gaps don't really mean a whole ton to us. Okay. They're not really dangerous. So yours is low. It's not something to worry about. But if your anion gap is high, that is a sign of the tissues in the body potentially not getting enough blood oxygen and causing a mismatch. So.
Got it. Okay. Let's look at the rest of it and see if there's any that you feel that are also important to cover here.
Let's scroll down to the part of your liver function, which would be where you see your T-Bili, your ALT, and your AST. There you go. Perfect. Those are great. Yeah. So when we're looking at the T-Bili, the Alk Phos, ALT, and the AST, This chunk of your CMP is actually looking at your liver function. Okay. So we're using these to assess how your liver is processing all of the blood that it sees. And so if you have cirrhosis or a fatty liver, your labs can be elevated. If you drink too much alcohol and you get an alcoholic hepatitis, you can also see elevations in your liver enzymes. If you have a primary liver disease, you also can see that the liver enzymes are going to be high, but we also look at the liver enzymes to make sure that the liver is getting the blood that it should. So if someone is very sick and critically ill and those liver enzymes go drastically, we call shock liver, could be really dangerous. And so signs, a lot of people may see an abnormal ALT or AST. And if it's low enough, that could be a sign that you have a fatty liver. Again, there's many different medications and supplements. Your liver filters out all the toxins in your blood. It's a filter. And so when you are taking supplements or you're taking medications, the liver is doing a lot of work. The same thing with alcohol. Your liver is going to be the one that processes all of the alcohol that if you drink alcohol. And so you can really damage your liver. Now, good news, your liver is one organ that regenerates. Okay. And so it can't always regenerate. Once it's fibrosed, okay, or scarred, we can't reverse scarring. So once you have cirrhosis, we can't reverse the cirrhosis. But when you have a fatty liver or you have fatty infiltration, you can do things to make an improvement. You can exercise and diet and lose some weight and take a statin to help reduce that fatty liver and to try to give you protection to make sure you don't progress to cirrhosis. You also want to avoid medications or supplements that could be what we call hepatotoxic or toxic to the liver. Your liver looks great though. So Spencer, you're doing a good job.
Thank you. What are those toxins that you could be taking that could lead to that?
Oh, well, this is a tricky question because I've had patients who've come in and started taking some herbal tea and their liver numbers went up, right? Mm-hmm. Tylenol it's hepatotoxic, okay? And so Tylenol is something that we watch. You don't want to, if you take too much Tylenol, you could kill your liver. It could be very dangerous. I have seen people who take a whole bunch of supplements and have increased liver function. We stop all the supplements because again, you have to remember supplements they're not FDA monitored and they're not regulated. So we don't know what is in them. We don't know where they're being created. And so sometimes people come to me and I say, easy things being easy, let's stop your supplements and kind of go from there.
Love it. Well, quick little reset there. Alrighty. And that brings us to the bottom there. Amazing, Dr. Saucier. I appreciate it. I think that a lot of people get overwhelmed with all this information. So really appreciate you breaking it down. If you are someone that's watching this video, have questions for her, put them in the comments below. And yeah, we can see you guys in the next video.
Thank you.